Hi, my name is Danielle Hausman. I'm an occupational therapist and rehab educator at the Craig H. Nielsen Rehabilitation Hospital. Thanks for watching this video on urinary tract infections following spinal cord injury. Please take a moment to read this disclaimer, and please keep in mind that this video is not meant to replace any medical advice from your doctor. Also, we update these videos frequently, so please make sure that you're watching the most current version of it. Here are the objectives that we'll go over in this video. So first, we want you to be familiar with the most common causes of urinary tract infections following spinal cord injury, and you'll commonly see urinary tract infection abbreviated as UTI. And we want you to know the signs and symptoms of a urinary tract infection so that you can recognize it right away if it were to happen. And we want you to know what to do if you suspect that you might have a urinary tract infection. So urological problems are one of the most common reasons why people end up coming back to the hospital after they've gone home after having a spinal cord injury. That the average person with a spinal cord injury will have 2 to 3 urinary tract infections in a year. And that's on the higher end for people that have an indwelling or a Foley catheter, and on the lower end for people that use intermittent catheterization for bladder management. So first of all, is it an infection? And it's important to know that urinary tract infections don't only impact the bladder, but they can happen anywhere within the urinary system, within any of the organs of the urinary system. And there's also this concept called colonization, which can be a little bit confusing, that any time that someone uses a catheter, whether it's a Foley catheter or an intermittent catheter, there's always going to be a small amount of bacteria in the bladder. But this doesn't necessarily indicate an infection. And so it's important for patients and providers to recognize this concept that the small amount of bacteria is always going to be there. And this can be very normal. So we must consider the presence of symptoms in addition to bacteria being present in the bladder or anywhere within the urinary tract. So here are the most common causes of urinary tract infections after spinal cord injury. So first, simply from not drinking enough. So it's important to drink the right amount of fluids, preferably between 2 and 3 liters of water a day, so that the urinary system is being flushed on a regular basis. It also could be caused by poor catheter insertion technique, that if the catheter accidentally gets contaminated with germs and bacteria, and then it ends up entering the urinary tract, that can easily cause a urinary tract infection. So it's important for you to get lots of practice with good intermittent cathing techniques to prevent this from happening. And there's also a lot of different types of catheters that are available, and this can make you less prone to having a urinary tract infection if you're using a type of catheter that works well with your body and is easy for you to use. So here are the most common signs and symptoms of a urinary tract infection after having a spinal cord injury. And you might have had urinary tract infections prior to your spinal cord injury, and it's going to be a bit different now. So we can't rely on those same traditional signs and symptoms like burning and pain, because you might not have sensation because of the spinal cord injury. So first is chills and fever, and not everyone will get chills and a fever, but it's possible that it could happen. And generally just feeling unwell. Some people will even feel confused when a urinary tract infection is coming on. You might also have an increase in spasms or pain, and spasms are muscle movements that are out of your control. And these spasms can happen within the urinary system or anywhere in your body. You might also have leaking of urine. So if you find that you're leaking in between catheterizations, we'd want you to call your doctor right away. And if you do have sensation around the genital area, you may have burning or pain with catheterization. You might notice that your urine smells a bit differently, that it has a foul smell to it, and it might be cloudy, and there might be pieces of debris or blood, things that might look like sand or sediment. So these would all be concerning signs and symptoms. So please contact your healthcare provider right away if you have any new or worsening symptoms that might seem like they could be a urinary tract infection. So after you call your provider, a couple different things might happen. They might help you to make an appointment so that you can have a physical evaluation. They might help you to determine if these symptoms are from another type of infection potentially, or based on your medical history and your symptoms, they might just be able to prescribe antibiotics right away. So to summarize, we know that UTIs are very common after having a spinal cord injury, and they can potentially be quite dangerous, that if we don't catch and treat them right away, they can easily spread to other organs and other parts of your body and cause serious illness. So it can be dangerous. So thank you for listening to this video, and please contact your primary care team with any questions.